when I say I really haven't stopped talking about it, like I have really not shut up about it. It's just been so eye-opening to see a new product on the market that is doing things that are on the forefront of cardiac event management. My name is Sarah Welburn. I am the lead nurse of Morgan County Schools, and central office is located in Decatur, Alabama. Morgan County Schools in total has 7,649 students on roll as of today. We have currently sitting at 67 AEDs across our campuses. I was looking for an AED management program this summer and came across Avive and really liked the product when it was shown to me. And then it's just kind of grown as the need and the campuses have grown. We've put more AEDs and more buildings. And even as I have been going out and putting Avive into our schools, I have seen a couple of places where we're going to end up needing an additional AED in a couple of locations. My nurses are really excited that they can have a program that is keeping an eye on their AED at all times, basically. Previous to having Avive on our campus, my nurses were making manual rounds on the AEDs on our campuses monthly, but sometimes we were having issues with an AED, but we weren't sure when the issue happened. Was it 5 minutes after we walked away from the last time we checked on it, or did it happen last night before we were doing our checks? So getting the real-time alerts with Real Connect has been fantastic so far. My nurses are really excited about it. They've loved it so far. And I like it on the administrator side because I can see our whole fleet of AEDs. When we chose to go with the Vive AEDs, I wanted all of my nurses to be able to have hands-on access to them. So initially I was looking at putting a large portion like just on one side of the county and then filtering across the county. But I really wanted everybody to have at least one on their campus so that they could start utilizing it, working with it. Our teachers could start training for our medical emergency response teams that we have on our campuses. That the majority of my high school nurses have chosen to put theirs is in the gym because we have lots of activities in our big athletic gyms and our athletic facilities between basketball and volleyball. And that's not just on the varsity side of stuff. We have middle school that practices there sometimes. My elementary schools have put theirs also in that front office type location. And then most of them have chosen their secondary location is our AED locations that are close to the cafeterias, which is also another location where we have lots of staff, parents, visitors. One of the things that we teach in our CPR classes is the removal of the bra for the female patients. And that's something that lay people or non-medical people don't think about. They think about an exposure risk where we're thinking about saving somebody. So Avive's caveat on there in their step-by-step instructions of using their AED, like my nurse was like, oh my gosh, it says like, do this part that, we've never had that before. We teach it in our CPR classes, but to have the AED to also remind school staff that needs to be done as well is wonderful. The other thing that my staff and nurses have been really excited about is that it's a fully automated AED. Nobody is having to press a button to shot. Like, I feel like non-medical people are nervous about delivering a shock to somebody. So for them not to have to physically touch the AED and that the shot will be delivered, I feel like relieves a little bit of anxiety and stress for non-medical people. You never know when a cardiac event will occur. And realistically, it's not where the cardiac event will occur, but when the cardiac event will occur. So I have always been a proponent of being proactive versus reactive. I would tell anybody in any sort of corporate setting, the school setting, any sort of business should have an AED on their campus because a cardiac event could happen at any time.